Okay, well I wanted to give you a quick overview of putting together medication cards. And you're going to want to put one of these cards together for each of the 56 medications that we're covering during the pharmacology course. I really think it's more of a learning experience if you handwrite these cards rather than cutting and pasting them on a computer. And I like to use the 5x8 note cards. So let's do one together to give you an example of how you can do one. Maybe you can do yours this way too. First thing we're going to start with is a drug, and we're going to write the brand name, which is Plavix, and we'll write the generic name, which is clopidogrel. Then we're going to write several things along it on the card to learn about this medication. So the first thing is, what class of drug is it? The next thing we want to look at is, how does the drug work? What's its mechanism of action inside the body? Why do we give it? What are the indications for administering this pre-hospitally? The contraindications. Why are there reasons that we would not give the medication? What side effects can we expect? Or what drug interactions exist along with this medication? Then we want to look at the dose. Is there an adult and pediatric dose? And if so, what is it? And then the last thing is which route is the medicine administered? Is it given IV, IM, sub-Q, PO, or some other way? So when we look at clopidogrel, we know that the class of drug is it's an anticoagulant and an antiplatelet. And it works by keeping platelets from aggregating and activating. And it does this irreversibly. And it blocks or inhibits the ADP receptor on the platelet. And so here you can see there's the receptors, and Plavix blocks that receptor, and that keeps platelets from aggregating. So the indications, people are typically given this for MI and stroke, but in the pre-hospital realm, we are usually just given it for a STEMI myocardial infarction. So some of the contraindications would be if your patient's actively bleeding or if they're hypersensitive to it. Side effects, of course, we might see the patient may have an increase in bleeding. They definitely have an increased risk of bleeding, and especially if they're on other blood thinners such as Coumadin or aspirin, we'd want to be careful. There are some drug interactions also, especially with PPI or proton pump inhibitors such as Prilosec and Nexium. Those actually are competitive with the site with with Plavix, and it'll decrease the action of the Plavix. So the dose, there's only an adult dose, and usually if they're on it daily, it's 75 milligrams, but for an AMI, it's usually 300 to 600 milligrams PO. Then the last thing we'll look at is which route we give it, and of course it's PO. And that includes crushing it up and putting it in an NG or OG tube. So that's it. That's all you need to do to put together a nice little study tool for you. And of course, this is worth points in your final grade. So get to working on those 56 cards. Good luck.